The causes of hair loss are quite vast. A lot of people are under the impression that it's purely a genetic driver, and that's a huge part of it, but it's not all of the equation. There are a number of other underlying health issues like just overall poor health. Anemia, especially iron deficiency anemia, is definitely a cause of hair loss. Men are also susceptible to this. It's not only a menstrual-related female problem. Chronic illnesses and stress that has a huge amount of impact not only on hormone health, but also can cause shedding of hair. Thyroid conditions can alter hair dramatically. Too much or too little can cause problems not only with weight, metabolism, energy, but also the overall thickness of hair as well. Autoimmune problems where the body's attacking itself also can result in damage to the skin, including the scalp. There's chronic inflammation and injury, obviously. Infections such as fungus infections or ringworm can also damage the scalp and impede hair growth and regrowth. Hormones, obviously, we touched on just briefly, are a very critical part of the equation, and may want to discuss with your doctor whether or not testing is appropriate. Medications have a profound effect on hair loss. There's a variety of drugs that can cause hair loss either at the start of taking them or during their prolonged use. I'm just going to touch on some of these, but there are blood thinners, gout medications, blood pressure medications known as beta blockers, even non-steroidal anti-inflammatories can impact hair. Blood pressure medications known as ACE inhibitors, acne medications, antidepressant medications, seizure medications, all can have an impact on the health of hair. There's obviously stress is a major driver. It's not uncommon to see someone who's undergoing, whether it's a physical or emotional or combined stress response, to lose a substantial amount of hair. And then last is just grooming practices. Tight ponytails, traction, excessively tight headwear can all put excessive pressure on the hair follicles and can be a contributing driver of hair loss. So these are just a few points to take home and discuss with your prescribing provider if you're considering a hair loss medication, or if you're seeing a hair loss professional. They're going to go over some of these lifestyle issues with you as well and see if there's something else that could be potentially at play in terms of what's causing an individual's pattern of hair loss.